this video, we're going to show you exactly what your specific condition entails, how to properly treat it, and maybe more importantly, how to keep that pain from coming back for good. Hi, I'm Johnny with MJ's right here in Fulton County, Pennsylvania. I've been treating this area and the surrounding areas for well over 12 years. I have 30,000 plus hours of actual hands-on experience in eliminating conditions just like yours. I hope you find this video valuable, and thanks for watching Pain Elimination TV. This video is on your specific condition, plantar fasciitis. Plantar fasciitis has many contributing factors, including tight calf muscles, being overweight, extremely high arches, repetitious high-impact activities such as running, and beginning strenuous activities without being properly conditioned, bad shoes, no shoes, dehydration, and diet deficiencies. So it has many different ways that it can be created, or it can be a combination of all the above. It's a fairly isolated issue. This is the fascia here that runs along the bottom of the foot. And because of the contributing factors previously mentioned, this area will grow shortened, thickened, very tight, and restrictive. Sometimes you'll also find that up in this area, in the metatarsal bursa, due to some of the contributing factors previously mentioned, this will also become an area of discomfort alongside the plantar fasciitis. A lot of times people who experience plantar fasciitis, they'll have some pretty strenuous pain that's right in the midst of their arch, but you'll have them also complaining of the attachment site back here, right at the calcaneus bursa here, but where it attaches to the calcaneus itself. And that's because it's pulling. As it gets tighter in the middle, it's going to pull away from this attachment, which is going to be creating inflammation and pockets of pain right here. This is also a great location because of plantar fasciitis, a contributing factor to the development of heel spurs, as well as heel spurs develop in this area as well due to the tension in the calf muscles and the tension that's put on the Achilles tendon. Now, a lot of times the pain is not just isolated to the plantar fasciitis itself, but because of the previous mentioned contributing factors, these particular muscles here will also grow very shortened, very tight, and very painful. What we do for treatment for this particular condition is we're going to massage very deeply into this tissue, bringing about circulation, flushing out the trash, flushing out the inflammation, bringing back some life and vitality to this area. We're also going to do some myofascial stretching, and we're going to do some passive-aggressive activated stretching. What we would also want to look at for this particular condition is we would work some of the muscles coming down the back of the leg. Now, these are two particular muscles that we would work. But also missing here is the calf muscle coming down and the soleus muscle. We also like to do a little more extra detail here at MJ's to make sure all the bones have proper free movement so that the muscles under the arch and the plantar fascia can also have as much free movement and the lack of restriction as possible. So we do some nice deep work in on the dorsal muscles here. We also do a little bone manipulation on these muscles, or on these bones here, to free up some space, to get some blood flow in there, to make sure if there's any trapped inflammation that can all be taken care of. Now, what you would want to consider after receiving the proper treatment Usually, as plantar fasciitis gets bad enough, if you do not already have a heel spur, the odds are a heel spur is on the way. So you would want to get proper treatment as soon as possible, because this can be a really debilitating condition. And a lot of people end up in their doctor's office, sent to a surgeon, and they'll actually slice and take pressure off the fascia. And if you can think about cutting something such as your fascia or soft tissue, you realize how that doesn't even sound like it makes sense. And for most people that I have experienced in my career, if they have had that particular procedure done, they have some temporary relief, but they end up having some complications down the road that aren't so easily resolvable. Plantar fasciitis, if treated properly, is very resolvable. And then after treated properly, what you would want to do, and during treatment as well, you would want to do this stuff during treatment at home to complement the treatment, and then continue to do it after you have the relief you're looking for, to ensure that this doesn't return. One, you would want to have a perfectly round bottle filled with water, and you would want to put it in the freezer. And you would want to take that out after a hard day's work as you're sitting back, relaxing, and running your foot over that ice cold bottle. Now, two things are happening. Because you're using the ice itself, you're getting a little cryotherapy, so you're going to help relieve any inflammation that's hiding deep within the foot itself. But also, because of the roundness and the pressure that you're running over the arch, you're going to be stretching the fascia and the muscles within the arch itself. Also, you would want to do a couple different style of stretches, which we'll speak about in later videos, that are designed specifically for the underlying of the foot. And you would want to do some specific stretches for the calf and the soleus. Now, all this you would want to do at home to complement the treatment in which you're receiving, but you would want to continue those particular treatments at home, periodically, 2-3 times a week, because plantar fasciitis is one of those conditions that it's based on your lifestyle. And unless there's something that can dramatically change in your lifestyle, the odds are that the plantar fasciitis will return. If you wish not to do those particular exercises at home, such as the rolling of the ice bottle, the stretching of the plantar fasciitis, the calves, and the soleus, that's fine. One of the best options you have available to you is just continuous treatment on your feet. There's nothing like having your feet treated properly. It feels wonderful, and it would also keep the plantar fasciitis from coming back. You would want to do that treatment approximately anywhere from every 3 to 6 weeks, depending on how strenuous your lifestyle is. I hope that this video was worth your time. It gave you a better understanding of your specific condition. I hope the time you spent watching this video was valuable. Now, if you want to be pain-free within 30 days or less, please give me a call. Let's talk. Phone number is 717-404-6495, and you can sign up for our pain elimination package, which guarantees with your specific condition, we will eliminate that pain in 30 days or less with a satisfaction guarantee. If you're not satisfied at the end of the 30 days, you get your money back. And our pain elimination package is half price. So if you want to get rid of your pain in 30 days or less, give me a call. And thanks for watching Pain Elimination TV.